everybody, it's Dr. Mona here at Mona Dermatology, and I want to personally welcome you to our 2020 anniversary event. For some of you, you know that we usually do a meet and greet, but with everything that happened with COVID, we actually wanted to change things up a bit and do something a little bit different. So tonight, we are going to be doing live demos of some of our favorite treatments. We sent out polls and asked you guys what you'd like to see, and we listened and are showcasing several of our treatments. So what we'll do is I'm going to go over a little bit of the information on each treatment, and then we're going to go into each room, and our providers will go over some of the treatments with our wonderful models. And I really want to make sure that you all ask questions, make sure that we're live, so anything that you ask, we'll try to answer it. And if we can't get to it in our time slot, then we will make sure to get back to you. In addition, we have people on the phones, and we also have our Clara, so if for any reason you need to call us or anything, please feel free to do so. So our first treatment, we are going to go over the differences between chemical peels and diamond glow. So chemical peels, a lot of times people are a little bit scared of the word peel, but peels aren't really that scary. A chemical peel is when you actually put different solutions on the skin and you peel the top layer of the skin off. There are superficial peels like fruit enzyme, lactic acid, and those really just treat the very top layer of the skin, and you exfoliate that top layer without very much peeling at all, and it leaves your skin looking fresh and kind of glowy. Our Luminize is a perfect example of that, or a lactic acid peel. A little bit medium depth peel goes a little bit deeper into the skin and takes off the top layer and then a little bit of the upper middle part of the skin, or the dermis. And in that scenario, you're going to have a little bit more peeling for a few days, and it is going to give you an even better result. Good examples of those are salicylic acid peels, which are great to treat acne and are safe in all skin colors, as well as deeper glycolic acid peels. Finally, there are the deeper peels that people think of when they think of a chemical peel that's a little bit, maybe not scarier, but a little bit more aggressive. And those are going to be your TCA or phenol peels. And in those cases, you're going to be peeling a lot longer. So we're going to go in the room, and I'm going to show you, Amanda and Shireen are going to be doing Shannon, and they're going to be doing a peel on Shannon's chest and then diamond glow on her face. So diamond glow. Diamond glow is an amazing microdermabrasion device with a diamond tip that actually is attached to a vacuum. And so you end up extracting and exfoliating at the same time as you're able to infuse serums into the skin. So it's a really great 3-in-1 treatment. It's not painful. It's very soothing. There's really no downtime with it. And so let's see what our ladies are doing. All right. So here we have Amanda. Hello. And Shireen.
Hi.
And Amanda, I'm going to ask you some questions on peels. So tell me, how does a peel work, and what does it treat?
So a peel is going to treat acne. It's going to help with acne scarring, melasma, any pigmentation. And it also helps with skin texture. After a peel, you're going to be a little red, and it's going to start to peel for about 3 to 5 days.
Perfect. And do you always have to peel with a peel? Because sometimes we'll have patients that call and they'll say, well, I didn't peel at all. Are you still getting a benefit if you're peeling after a peel, even if you don't peel?
Absolutely. Everyone's skin reacts very differently to the peels. You're still getting some great cell turnover, and your skin is still going to feel amazing after the peel. So if you don't peel, especially with our Luminize peel, which is our lightest, you're still getting that great cell turnover, and you're still going to have that smooth, nice skin afterwards.
Right, exactly. And what kind of things would you treat with a peel? Oh, sorry. I just got told by Casey, our marketing director, that I have to hold the mic to myself, so I'm sorry. So what was I asking? How often would you do a peel?
I would do a peel about every 4 to 8 weeks, depending on the severity of the issue that you're trying to treat. You kind of want them to compound on top of each other. It's kind of like going to the gym once. It's not going to really do anything, so you kind of want to do it more frequently so those results start to build together.
Right, exactly. So a lot of times people will say, how often should I do it? And we'd really love to have you do one every month. for about a series of 3. And then sometimes it's great to have a maintenance peel because peels are a wonderful way to maintain your skin for, I'd say, every 3 to 4 months. Okay, so as you can see, we've peeled. She's right now applying the retinol. So as I said, there's a series of chemicals that we put on, and Amanda's applying the retinol. She's already applied 2 passes of, what is it, the Vitalize peel?
Yeah.
Right, so she's applied the Vitalize peel, and now she's applying the retinol. And the other thing I'd say is, what should you stop using before a peel?
You are going to use or stop using any retinols and also any topical acne creams that you might be prescribed by some of the providers as well.
Right, so make sure if you're on any kind of tretinoin or retin-A or retinol that you stop that a few days ahead, only because it can kind of supercharge your peel and you'll peel more. All right, so very curious here. I see Shireen. Hello, Shireen. She is doing the Diamond Glow on Shannon's face. So what does a Diamond Glow treat?
Well, Diamond Glow can treat multiple conditions. For her, we're going to brighten her skin a little bit, so we're using the vitamin C serum, which is an antioxidant serum. But we can treat anything from brown spots to dull skin to like that dehydrated skin, those little fine lines. It's great to freshen up the skin, and there's no downtime, so that's the greatest advantage.
Right, so a lot of times for people that don't want any downtime, a Diamond Glow might be a better treatment than a peel. What are the different types of serums that you would use and why?
All right, so there are 5 serums. One is the pore clarifying, and that's great for people who are acne prone. So it has salicylic acid in it. So it's awesome for the acne prone and oil, people who produce a lot of oil. There are the vitamin C serum, which is the antioxidant. There's the TNS-A+, which is the brand new serum. It is great for fine lines, kind of collagen plumping, anti-aging, and it pairs really well with the awesome new serum, the TNS-A+. You're supposed to use that in conjunction with it. And then there is the brightening serum, which is great for those brown spots, a little bit of dead, dull skin, especially after summer.
So guys, who do you think peels would benefit from? And Diamond Glow.
So peels would be great for anyone with any teenagers, especially with active acne that maybe aren't ready to go on any prescriptions yet. Peels are a great way to kind of treat those. Also, women with melasma, the darkening of the skin, the spots on the skin is really great for that. It kind of helps with those. So peels are really great for all skin types.
Acne scarring too, great.
Yeah, and acne scarring.
Yeah, acne scarring is awesome.
Yeah, so peels are great for both acne scarring. We love them for melasma because they don't produce heat. And the Diamond Glow is really great for people, especially on face as well as off the face. I know we're showing the face now, but the nice thing is that you can actually do it all over the body. All right, do we have any questions? Okay, anything else you guys want to add?
Come visit us. These are awesome treatments. You will love it.
Okay, that's awesome. Yeah, we can see what Shireen's doing right now. Oh, one of the things I really want to show you guys, which is awesome with the Diamond Glow, is that if you look right here, this actually is all of the impurities, oil, any dirt, and blackheads that we're extracting, as well as, helping to exfoliate. So at the end of a treatment, it's really satisfying because you end up being able to see all of the stuff that's on your skin. So it's really, really a cool treatment. We love it, and patients love it. All right. So ladies, I will be back to see you do CoolSculpting in a little bit. All right, we'll be back to visit them. Now we are going on to see Botox and fillers. So Botox, a lot of people have heard of Botox, and Botox is really an onabotulinum toxin, which helps to prevent muscle movement. So muscles of facial expression actually insert into the skin. So when you frown, raise your forehead, smile, you end up creating a little bit of a line or your expression. So as you get older, those lines become what we call wrinkles at rest. And so you, over time, end up having a wrinkle that just stays there. And a lot of times people will see the 11s, or they'll see their crow's feet, or they'll see your forehead. So, question?
We have a quick question on
yes.
peels. Are they good for patients with rosacea?
So peels and rosacea I probably would not do, and I probably also would not do a diamond glow because of the extraction. It might actually irritate your rosacea. Rosacea skin is very sensitive. I love either the salt facial for rosacea or an intraceutical, which is an oxygen facial. And the other thing that you can do for rosacea is some of our other light and laser treatments, which Anna's going to show you in a bit, but we really love IPL and V-beam for rosacea, but I would probably not necessarily do a peel on rosacea depending on your skin type. Great, so I love having questions. Please keep them coming. So Botox, like I was saying, a lot of people know that Botox treats the upper third of the face, but we can use Botox other parts of the face. So when we go in the room, we're actually going to have Jessica, one of our providers, doing Botox and filler on Janeth. And so she's going to show you some of the other things that we can use Botox for on the lower part of the face. Botox lasts about 3 to 4 months, and it's great at not just treating a wrinkle that you have, but it's also great at preventing your wrinkle from getting worse. So we have a lot of people who come in now, younger people who say, I don't even want to get the wrinkle. And so I think it's a great way to help kind of do what we call pre-rejuvenation, so helping you to prevent some of the aging that you can naturally see.
We do have a question.
Yes.
Does Botox for migraines also get rid of the wrinkles, or is that a different injection site?
Actually, Botox for migraines, sorry, oh, repeat the question. So the question was, does Botox for migraines also help to treat the wrinkles? And so Botox for migraines actually ends up using a lot more units than we would normally treat in the upper part of the face. But you do treat this area, you treat up into the hairline, you end up treating the back of the neck back here, and even kind of where your shoulder muscle is. So it can help your wrinkles, especially when you're treating this part of the face, but there are other parts of the body that you treat when treating migraines, and it's a wonderful thing. So fillers, on the other hand, are not Botox. Fillers actually replace lost volume, and we use them a lot to help lift and to plump and to smooth the skin. So what we're going to be showing you today, a lot of people know that you can treat the cheek to lift, you can treat your nasolabial folds, but when we're looking at the face, we oftentimes are looking at the whole face. And so Casey just handed me one of my visual aids, but when you look here, you want to have this triangle of kind of a youthful appearance, but as we get older, the triangle flips and you start getting bottom heavy. So a lot of times in fillers, we'll treat kind of the cheek and temple area to lift up, and as we come down, we're trying to recreate that beautiful V shape. So let's go in the room and see what Jessica and Janeth are doing. Well, hi guys.
Oh, hi.
All right.
Hello, everybody.
All right, here we have Jessica, our wonderful provider, Janeth, our nice model, and then Brooke, our nurse.
Yes.
So, what are you guys doing?
So we are up to in here. So we are,
Oh, hold on.
okay.
Guys, I'm unteachable apparently. I keep forgetting to show people my mic. So, and I'm not a mic hog. So, here you go.
Okay, so we are actually treating Janeth. We're focusing actually on the lower face. And so for Janeth, she's actually lucky. She has a lot of nice volume into her face, but an area where we thought we could give her more youthful contour, and even help some of the area where she's had kind of some volume loss, some damaged collagen from acne scars, is kind of this pre-jowl sulcus, kind of just in between her chin and the jowl area. So we tend to see some loss there. So I've actually already filled some on this side. We gave her just a little bit of filler in her chin, and that actually helps to kind of give her a nice taper of the chin versus kind of that more boxy look. And then we even gave her some filler kind of back here on the mandible so that she kind of has this really nice streamlined contour. Everybody wants a nice sleek jawline right now. So I'll go ahead and I'll kind of continue on and we'll treat the other side.
This is a beautiful result. I don't know if you guys can see this, but I want to have Janeth sit up for just a second. And I want you to look at how amazing this side of her face looks And the fact that this is all nice and smooth, you're bringing back that point. And if you look over here, you can see that she's lost that volume as her face is kind of falling down, and she doesn't have as much of that crisp. This is beautiful. I'm so glad we did half of the face.
Yeah.
The other thing that a lot of people are doing is now they're really focusing on the chin, because as we age, we actually lose some of our bone, and so we lose some of the structure of the skin, and the chin starts going backwards. And so Jessica has really wonderfully been able to kind of bring back some of that chin. So we can kind of see what she's doing right now. So fillers are naturally occurring products in the skin. Most of the ones that we use hyaluronic acids, we can use calcium hydroxyapatite. There are other fillers that are not as naturally occurring. You might need to do some skin testing. But the great thing about like something like, which one are you using?
I'm using Juvederm Voluma.
Okay, so Voluma is a longer lasting filler. It lasts about 18 months, and it's really good at lifting, and it just got FDA approval for the chin.
Could you just lower her down just a little bit?
Oh, so that she can see her better.
We have a promo right now on that too.
We do have a promo. So one of our promos is the filler promo that we have that you can look up online, but we also have $100 rebates on our Voluma, and it's a really, really great filler. I've actually had Voluma done in my chin as well. All right, so any questions so far, guys? No? Okay, great. So the other thing I wanted to talk about is Botox. And I know that you've done a little bit of a filler. What type of, where would you do Botox on Janeth, and why?
Yeah, so a lot of people are familiar with the really common areas to treat. We all know about treating the 11s, treating the forehead, treating the crow's feet. There are so many other places to use it. So so to look at Janeth, one area that bothers her, for example, is she's actually interested in maybe lifting her nasal tip. So you can actually do a very small amount of Botox right here, kind of right under her nose, and it'll gently just give her that little lifted tip that people love. The pebbly chin, okay, so as we age, we kind of get that orange peel look of the chin, and so we're going to soften that on Janeth. It'll actually bring her chin down and help with that kind of tapered, contoured look that we're trying to get also with filler. So again, combining treatments is key when we're trying to achieve these things. Another great option to try to shoot for Janeth in achieving that contoured jawline is with the Nefertiti lift, right? So that beautiful jawline is timeless. Nefertiti had a beautiful jawline. So Janeth, I don't know if the camera can see this, but if she kind of clenches her teeth here, you can kind of see this flat platysmal muscle here. It actually connects up from the clavicle to the mandible. And by injecting a little Botox at that insertion point, we're going to kind of relax that muscle and give her that really nice jawline she's looking for.
Right, and we do have a question. So
Yes.
repeat it after I ask it.
Okay.
Are there any side effects from Botox? This is probably silly, but I worry about it freezing other muscles in my face, particularly my eyes. I currently have a lazy eye, somewhat.
Okay, that's really a good question. So it really depends on, oh, the question was, can you repeat it again?
Yes.
Are
side
there
effects
any
from
side
Botox.
effects from Botox?
And could you get like a lazy eye?
And
or
can you
affect
get a
other
lazy
muscles?
eye, or can it affect other muscles? So most of the side effects from Botox are if you get a little bit of a bruise, and that happens sometimes, most commonly I'd say around the eye area, it could happen. I've had a few people have some headaches, although that's not very common. And then can it spread? So Botox should be injected into specific muscles. If it spreads to the wrong muscle, then that's what happens with a lazy eye. So part of that has to be injector technique. So you have to know what you're injecting, where you're injecting, and it actually also depends on the toxin. So it actually segues into one of the things I wanted to talk about, which are what kind of toxins are there? Well, Botox is the one that came out first. It's the most well-known, but there are other toxins on the market. There's Xeomin, which does not have the carrier protein. There's Dysport, which actually diffuses more. So I might not necessarily want to use Dysport in an area that I want to be very specific. There's Jeuveau that has a much faster onset. And then there's also, what's the other one? Oh, Revance, which just came out. And that one is has a longer lasting ability. Guys, I'm being told I have to leave. Thank you, and we'll see you at the end. Okay, so now we're going to visit Anna over here, and she's going to be talking about IPL and Fraxel. So IPL and Fraxel are light and laser treatments, and IPL, I'm going to have my visual aid again. So IPL is a broadband light, and if you can see here, it kind of targets a wider area, and it uses filters to filter out the right wavelength. A laser, on the other hand, is a monochromatic light, so it actually targets a very specific chromophore in the skin, like melanin if you want to treat laser hair removal, or it targets hemoglobin if you want to treat blood vessels, or scars, or rosacea, or if you want to do resurfacing, you can also target water, where we would do either like a Fraxel or a CO2. So lasers are a little bit more specific. If you're treating hair removal, interestingly, you can actually use an IPL or a laser. So it all depends on what you're trying to target. So Fraxel, I'm going to go over another diagram here because I am very visual. So Fraxel is actually a non-ablative fractional laser. And what I want you to focus here is a lot of the older, more ablative lasers would actually take off the whole layer of the skin. But Fraxel heats columns of skin, leaving normal skin in between, and that normal skin actually allows you to heal a lot faster. Now, if you had more wrinkles or acne scarring, you might say, well, actually, I really want to do more of an ablative laser like a CO2 or an erbium, and that's actually going to burn away columns of skin. So in our room, we have Carly, and Anna's doing IPL on her face, and she's going to do Fraxel on her chest. So let's.
One last question. If your forehead 11 line wrinkles are deep, do you use just Botox, or can you use fillers to overall fix the problem?
Right. So I would say.
Sorry, say the question.
Oh, sorry. If your forehead lines are deep, would you just use filler, or would you also? Would you just use Botox, or would you also use filler? So number one, I would do Botox. If your lines are already so deep, there are other things you could do. A lot of times we do threads. So there's threads, which we're going to talk about towards the end of our demo here. And threads help to build collagen. You can do fillers in the forehead, but I will tell you, you have to be very careful, and you have to have a very experienced injector because you don't want to get into the wrong vessel in the forehead. So it can be done, but I would say that you have to have someone who's very experienced. In addition, you could also do tightening procedures that might help to also build your collagen, like Ultherapy. All right, let's go see. I love the questions. All right, hi guys.
Hi.
So we are here, and Anna is our wonderful nurse practitioner. Carly is our patient. She has her eyes covered. And over here we have Alicia, our wonderful nurse. So what were you guys just doing?
We were just doing IPL on lovely.
Oh, hold on. All right.
We were just doing IPL here on lovely Carly's face. She's got a little bit of redness and rosacea, so IPL really helps to target red pigment. It can also target brown pigment as well as some blood vessels. So we actually had just finished up on her face, and we're going to move on to Fraxel on her chest. If you can see, we actually already did half the chest, which I marked out. So she's a little red here, which is exactly what she should be. Carly's really young, so she doesn't really have a ton of sun damage on her chest. So we're primarily doing Fraxel for her to kind of prevent the aging process, improve her texture, fix things like laxity, but Fraxel can do a whole host of other things and concerns for people.
Yeah, that's great. So now IPL. So for Carly, we did a little IPL because she had some redness.
Correct.
So describe to me, when would you use an IPL versus using a different treatment for redness?
Sure. So IPL is great for kind of that more diffuse redness, and also for more of like the blood vessels. She doesn't have a ton of brown, but IPL would be great for that option as well, especially if someone has both concerns. Using a different type of laser can sometimes exacerbate redness or rosacea, so we want to steer clear from that, especially on her skin type.
Right. And the other thing that you could do is if you have somebody who has like very specific vessels, you could always do a V-beam, which is a laser that targets just the hemoglobin. So you can do IPL and V-beam for redness. Now, like Anna said, IPL is amazing at treating sun damage. So you have somebody who comes in who's got brown and red pigment from kind of just being in the sun. IPL is amazing. Now, what downtime can she expect from the IPL?
So she'll be a little red and pink today, but by tomorrow she's going to pretty much look back to normal. If she did have some brown pigmentation, sometimes that can appear a bit darker, and it almost sloughs and comes up to the surface, and that takes a few days to go away. Comparatively, well, backing up a little bit, with the IPL, she can exercise, she can put makeup on, so it's very little downtime. Comparatively to the Fraxel, she's going to look a little bit more red, maybe get some flaking and peeling. Typically that lasts about 5 to 7 days. So a little bit more downtime involved.
Right. So, and Fraxel, tell me what other things, like let's say for example, she had some acne scarring. So how many times would you treat somebody, for example, with acne scarring with Fraxel?
Sure. So Fraxel is a laser. Obviously, we just talked about the downtime. And it's something you would want to wait a little bit of time to repeat. Acne scarring is a great treatment option for Fraxel, but you would want to do it, I'd say probably 2 to 3 times, but spaced several months apart. So maybe 4 months out, repeat the treatment.
Right. So Fraxel is a great treatment. It's a great rejuvenation treatment. You do have a little bit of downtime, but it's not scary downtime. It's really just you're kind of pink. Your skin feels like sandpaper, but you can be out and about doing things. I had my Fraxel on a Friday and I was at work on Monday, and I actually went to my daughter's soccer game the next day with but a very big hat and sunscreen and glasses. And so that's another good point, is you do want to make sure that you're not tan when you get these done. So fall and winter are a great time to do these. So would you, with the Fraxel, is there anything that you would add to it like PRP that might help the healing and the skin rejuvenation?
Yes, so PRP, which stands for platelet-rich plasma, is a great option to add to a laser-type treatment. It's going to increase the speed of her healing, as well as underneath the skin start to build up that collagen even more than just a Fraxel rejuvenation would do. It's also great for scarring, as well as things like let's say breast augmentation scarring, stretch marks, thank you.
Right.
That would be a great option to add PRP with.
Yeah, that's perfect. All right, should we see some? Perfect. Okay. Now, with the Fraxel, we don't have to necessarily have eyewear, but if we do the IPL, we do want to make sure that we cover our eyes. So one of the things I always make sure we're careful about is eye protection when it comes to lasers. So what you can see is that Anna's actually going up. Now, Fraxel is an amazing laser. It has 2 wavelengths, and there's a 1550 wavelength that goes deeper into the skin, that's better at treating things like fine lines, wrinkles, acne scarring, and it also has a 1927 wavelength, which is really good at treating brown spots, texture, and pore size. And so right now, Anna's actually doing the 1927, and it's great because we can customize this laser. We usually do 8 passes, but we can kind of customize which laser we're using to address which concern. Now, the other thing while Anna's doing that, I wanted to ask her is a little bit about a different laser we have in the room we're not doing today, which is the PicoSure laser. So with the PicoSure, can you tell me what you would use that for?
Sure. PicoSure is a great laser option with very minimal downtime. It helps treat things like texture of the skin, tone. It helps with acne scarring, and it's a great safe treatment for those with melasma as well.
Right, so PicoSure is actually a laser that doesn't use heat. It uses the very fast pulse of a laser to be able to kind of shatter the collagen in the skin. It's actually a tattoo removal laser, and what it helps with is it helps to kind of rejuvenate the skin at the same time. The great thing about a PicoSure is that there's really no downtime, and you're pink for a couple hours and then it goes away. All right, so the IPL, the question is if we want to show that, wonder if we just have to have our eye protection. Maybe it wouldn't be a great idea. Could we do it for a second? just turn it on. And then we're gonna move in a second to microneedling. Oh, here's your glasses. Okay, and then before you do it, Casey and I don't have eyewear.
Okay.
So we're just gonna put some glasses on. Well, that's all right, we'll just close our eyes. All right. All right, so they're gonna be using their eyewear and showing the IPL.
I'll warn you guys.
All right, go ahead.
Go ahead and close your eye. Here we go.
So you can see that it's a very, very bright light, and that's why it's called intense pulse light.
How does that?
And really it just feels like a hot little rubber band snap.
Last back here.
All right,
And 2.
perfect. All right, guys, thank you so much. So we will be back in this room in a little bit and show you threads. Bye, guys, thank you. All right, so our next thing is microneedling and PRP. So PRP stands for platelet-rich plasma, and we have actually been doing PRP for a number of years. What is platelet-rich plasma? So we draw your blood, we spin it down, and we collect the platelet-rich portion. That platelet-rich portion has growth factors. So what is so important about growth factors? Growth factors, when you inject them around the surrounding skin, actually help to regenerate and stimulate those cells. So we've been doing it for hair loss for a number of years. We collect that platelet-rich portion and we inject it back into the scalp, and it helps to stimulate hair growth. So PRP is great for people who have thinning hair and want to actually stimulate some hair growth. It's been around for a long time. We've used it in sports medicine and in dermatology. Like I said, we do hair loss. We also do rejuvenation. It's known as the vampire facelift, but it's not scary because we actually use a collection system here that does not show red blood. It's like a clear yellow amber serum. It's like liquid gold, and PRP is amazing. They now are using it for kind of helping with breast rejuvenation. You can use it in so many different things. So we are gonna go see Megan, and Megan is gonna show us how she's been using PRP on Natasha. Now, microneedling, as opposed to lasers, helps to create a little bit of injury without heat. So when we were talking and I was showing you the Fraxel, you could see how Carly's chest was a little bit red. Well, heat, when you deliver heat, it actually helps to stimulate collagen. But not everybody should have heat. Like if you're somebody who has a darker skin color, you might not want to have a laser that produces too much heat. If you have melasma, you might not want to use too much heat. So microneedling is a great treatment because it creates little zones of injury with acupuncture-like needles. You can adjust the depth depending on where you are on the skin and the face and the person that you're treating, and then they heal a lot faster. So I think we're gonna go in and see what Megan's doing. Hello, guys.
Hi there.
All right. So we are here. So if you want to turn it off for just a second.
No problem.
Okay. So we just talked a little bit. Here's Natasha and Megan, our wonderful provider, and then Angie, one of our great nurses. Thank you, guys. All right. So tell me a little bit about what you've done so far.
So we're doing microneedling with PRP on Natasha. So we talked about this is a great treatment for her because she has a little bit of acne scarring that we're dealing with. So microneedling is a great way to just help rejuvenate, break up some of that scar tissue, promote some collagen rebuilding. And then in addition, you can add PRP, where I think you talked about going into a little more detail about when we draw your own blood and get the PRP, which is high in growth factors. And then what we do is we inject the PRP directly underneath the skin, oftentimes using a cannula to do so. The nice thing about injecting PRP is that you can also do some subcisions along the way, which means you're breaking up some of that scar tissue. So you're not only doing that, but it's a great rejuvenation and just helping with the scar tissue altogether. So we started on one side of the face. We already did the injections underneath the skin, and we started doing microneedling on the left side of the face. And now we're just going to get started on microneedling on this side of the face.
Okay, so Natasha, how does it feel?
Feels kind of like a cat licking your face a little bit. It's kind of nice. Like it's not like intolerable at all.
Right.
Yeah, and there's no heat like with the laser, so I feel like this is way better.
Yeah.
So
Right, so this is a great treatment. This is a great treatment for somebody, like I said, who doesn't want the downtime of a laser and definitely doesn't want to have as much of the heat delivered to the skin. I love this treatment for treating acne scarring because, as Megan said, when you subsize, so what you're doing when you have scars is you have little scars under the skin, and subsizing the skin actually helps to lift up those scars. So as you can see, Megan is microneedling the PRP that Angie just applied to her skin. And like I mentioned, if you look, it's kind of a yellow amber liquid. It's not red, it's not scary. And the great thing about this is it's your own blood. It's like your body is harnessing its own power to heal and rejuvenate itself. Now, when you go over the forehead, you can get a little bit more red. And on a forehead, I would go on a lower depth, whereas if I do the cheeks or the chin or even the upper lip, I'd probably go a little bit deeper because the tissue there tends to be a little bit thicker. The other great thing is you can treat under the eyes, and so that helps with some periorbital rejuvenation as well. So yeah, so it's very easy.
How's it feel right now when we're doing this, Natasha?
it's not bad at all.
Yeah. She's really tolerating this really well.
Yeah, no, she's doing great.
So I am going to go up on the strength like Dr.
Oh, sorry.
Oh, sorry. I am going to go up on the strength like Dr. Flo had mentioned. We just finished the forehead, and now we're going to go to a little, we're going to increase the depth that we're going because we're going to, moving on to the cheeks now.
Yep, so we're going to add a little bit more there. Now, the downtime, like she mentioned on PRP, is usually a couple days, and you don't have to have it injected under the skin, but we really feel like that helps it work a little bit better. I have patients who come back over and over again saying that they really felt like this was a great treatment. As I mentioned with Anna, this is a great adjunct to add to any laser treatment because it also really helps your skin heal faster. And see, it's actually, she's very comfortable. She's a little red. That redness will go away by tomorrow. She'll be significantly less red. And really within 2 to 3 days, she should be completely back to normal. Now, I will say that you don't want to put anything on your skin other than an approved serum because you don't want to have anything get into those little holes. So we are very careful with what we use afterwards. All right, that's awesome.
Great.
So, and PRP is just, I feel like it's one of those things that we're going to keep learning more and more things to use it for. So, all right, ladies, thank you.
Thank you.
Perfect. All right. Yes. Okay.
Does microneedling affect the duration of your Botox?
You know what? That is a good question. That is a good question. I'm not oh, I keep forgetting to answer the question. Does microneedling affect the duration of your Botox? I don't think that it should. And the reason is, if you think about how Botox works, Botox is actually injected into the muscle. And it works by preventing the signal that goes from it goes to the signal to the muscle to work. So microneedling does not go deep enough to actually affect that muscle. So it really shouldn't make a difference as to how long your Botox lasts. Now, I probably would not do Botox and then microneedle because that vibration could diffuse the Botox to a different muscle. It could, as we inject it, it could actually cause it to diffuse. But once your Botox is kind of set in, it should be in that muscle and it shouldn't really be going anywhere. But if you could do them in the same time, I probably would do microneedling and then do the Botox at the end. Okay, perfect. So our next room is we're going back into room 1 where we had Amanda and Shireen, and now we're going to talk about CoolSculpting. CoolSculpting is one of the most amazing treatments for fat that is around. It actually was developed by a group of Harvard scientists who used the theory of popsicle paniculitis, which is basically children would suck on popsicles and they would lose the fat in their cheek, but their skin would be fine. And that is because fat freezes at a different temperature than the skin. So you can actually freeze the skin doesn't get affected, you bypass the skin, and then you freeze the fat, which causes fat cell loss, and then the fat cell kind of dies and it's excreted. So it is excreted through your liver and your kidneys, and it just kind of goes away. Sometimes people ask, well, what happens to my cholesterol? Does my cholesterol go up because now I have fat going through my system? And the answer is no. They've actually studied it up to a year, and there were no changes in people's blood work when looking at that. Now, CoolSculpting is one of those things that you can treat kind of head, like a chin down to your knees. It does do better if you do more than one treatment. We'll go in and see what they're working on. And it's been around a long time. There's a lot of different fat treatments that are out there. One of the other things that we have is Kybella. And Kybella is an injection that actually dissolves the fat. So it's deoxycholic acid, which your gallbladder makes to dissolve fat after a fatty meal. So we use it for kind of more specific areas. So let's say, for example, you had someone with a double chin. If they had a little bit of fat, we might just do Kybella. If they had a lot of fat, we'd do chill it and kill it. So we'd chill it with the CoolSculpting, kind of debulk that fat. And then if there's an extra little bit, we might actually inject the Kybella to chase the fat. All right.
We also, in that same note, have a question about those compared to using the Voluma to sculpt the jaw.
Oh, right. Well, actually, you could, so the question is, Casey's going to kill me because I keep forgetting to repeat the question. So the question was, what's the difference between doing Kybella versus Voluma to sculpt the jaw? So really, honestly, in a consultation, we would look at you and tell you if we felt like you needed one or the other or both. And a lot of times it's great to do the Kybella anyway to help get rid of a little bit of the fat. And we also use it to treat the jowls. I myself have had it done and I think it's amazing. But we can then layer it with a filler to kind of give you that snatched jawline. Now I think I'm really hip, but I'm not. But that snatched jawline that people want, which kind of comes up. So a lot of times we'll do both. And it doesn't mean that you do one or the other. And honestly, doing a collection of treatments together is going to give you the best result. All right, let's go see what Sharina and Amanda are doing. Hello, ladies.
Hello.
All right, so here we have Janae, who has so bravely said that she would be our model. We're back with Amanda and Shireen. Oh, it did? I'll put it on. All right, so Amanda, tell me what treatment areas can you use with CoolSculpting? Hold on, I'm gonna come on over here.
Okay, so with CoolSculpting, you can start pretty much at the head and almost go all the way down to the toes. You can do your chin for people that have that unfortunate little double chin that can be hereditary, very commonly hereditary. You can treat this little fat area right here. It's called like the teacups. You can do the arms. You can do your abdomen, your flanks, anything up and down the back you can treat as well. For the legs, you can do the outer thighs, the inner thighs, and then you can do your knees as well. So pretty much the entire body we can CoolSculpt.
Yeah, you can go knees to chin.
Knees to chin, that's right.
So now, how long would you say it takes before you can see a result?
So you'll start seeing a result as early as 5 weeks. Typically, you're not going to see anything until around 8 weeks. We have you come back for your second treatment at between 6 and 8. We'll take photos, and there will be some difference, but your max results are going to be 12 weeks after your final treatment. Oh.
All right. What?
She could.
Oh, sorry. All right, and how much fat reduction do you think you would see?
So in an area, you can receive up to 25% fat cell reduction. And typically, we always recommend 2 full treatments on an area, unless it's a very small amount of fat. But you know, all the pictures you see online and on their website, on our website, are always 2 treatments. You can definitely do more treatments on an area if necessary.
Yeah, perfect. Yeah, that's great. All right, and now I'm going to come and ask Shireen a couple questions. So when I look at Janae here, I notice that she has these 2 machines hooked up. Can you tell me a little bit about why she has 2 machines?
Well, we can dual sculpt because we have 2 machines now. We used to only have 1, but we want to treat both of her flanks. So we're treating her lateral flanks right now, and these are suctioned on her. So we can treat double the area at one time.
So how long is each treatment that you have her hooked up with right now?
So this is the Advantage Plus. So this gets a little bit more fat. So this one's 45 minutes, but they range from 35 to 45 minutes. And then there's one that does the outer thighs, and that one is an hour and 15 minutes.
Right. So the great thing is that by doing dual sculpting, you actually cut your treatment time in half. And who doesn't want to get double the results in half the time? I mean, I know I do. When we first brought on our second machine and I had my flanks dual sculpted and it only took 35 minutes, I was like, oh my gosh, this is amazing. Because in 35 minutes, I had 2 areas treated. So dual sculpting is really a great thing to do. I personally have had my outer flanks done and it really, really helped. I've had my abdomen done, I've had my back done, and I think that it definitely works. And I love the fact that there's really no downtime. So what would somebody like Janae expect during her treatment, and then tell me after her treatment what she should expect?
Okay, so during her treatment, I just asked Janae, well, what do you feel? So she said, I feel a lot of suction. Like when I put this on her initially, before we hit the go button, there's a lot of intense suction. And then we hit the go button, she said it's just freezing. It gets really cold. And then it starts to come a little bit tingly, like a tingly sensation. And then it goes numb. And then you can do work, you can do whatever when you're here, make some phone calls. And then afterwards, so right when we're ready to take it off, it's kind of like the sensation of when you put your fingertips underneath the like warm water after they've been frozen outside for a while. So it's like that rush in of warm blood. And we use the warm towels from our towel warmer, and we just start massaging it. And that helps bring the blood to the area and reperfuses that area. So then afterwards, she might be a little bit sore. We do a pretty good size or good massage afterwards. And then,
and you really want a good massage because it definitely gives you a better result.
Yeah, study shows up to 68%. I looked it up to 68% more a result just from the massage. So we do the massage, and then afterwards, up to, I'd say around a week, maybe even up to 2, you might be a little more sore, sometimes swelling. For like a week, you might be a little swollen. Some people say it's itchy. The top skin almost always is numb, at least for the first week. Sometimes it lasts up to 8 weeks. And then it feels like a lot of people say like you worked out really hard and you have lifted a lot of weights, and that's kind of how that pain feels, and then it goes away. So it's almost like you had a really good workout, and then however long it takes for you to recover from a workout is kind of very similar.
So, yeah. Do you guys want to?
Oh, no, she's not finished yet.
Oh, yeah, she's
Oh,
not
yeah.
done. Well,
No.
if you look, you can see that she has how much time left on? 23 minutes, and on this one she has 28 minutes. So I did want to point out that there are different applicators for each area. So the one that they have on Janae is actually twice as big as one of the, the Cool Advantage versus the Cool Advantage Plus. So it's twice as big. So you're treating actually twice the area, and it's only 10 minutes more. So for the right person, that's a really good treatment. But like I said, you can treat under the chin. That's about 45 minutes. And then the other ones range usually 35 minutes. Now, I did have a question for each of you. What is, oh, okay, go ahead.
The first question, can it help the banana roll under your butt?
Oh, yeah. Yes, that is another roll.
Can it help the banana roll under your butt?
Yes, it can. That is one area I did forget. As long as there's a very obvious bulge, you wouldn't want to treat your actual butt, but you can treat directly right underneath it. Absolutely.
And then also, does CoolSculpting work on ladies with older skin?
So it really depends on if you have, does CoolSculpting work on ladies with older skin? So the question is do you have pinchable fat, or do you just have loose skin? If you have loose skin, I wouldn't say that CoolSculpting is the right treatment. If you have pinchable fat, then CoolSculpting would work. Do you have anything to add to that?
You can always combine it with the Transform Elastin Transform Cream, which will help contribute to tightening a little bit of that skin, but it does work on getting rid of the fat on older skin. You might just have a little bit more laxity that we can end up treating with the numerous other treatments too.
Right, exactly. So your favorite treatment?
Like area?
Yeah, favorite area.
I would say my abdomen. I just recently had a baby, so it really helped get off that last little bit of baby fat that I still had. So definitely abdomen.
Okay, and Shereen, what's your favorite area?
I think for patients or for the clients that we've had, I would say the double chin underneath here because it makes such a big difference in confidence, and it's an area that's genetic. So, yeah, the double chin.
All right. I have one more question.
Yes.
Can you exercise while getting your CoolSculpting treatment?
Can you exercise while you're getting your CoolSculpting treatment? While, no, obviously, just kidding. But you can certainly exercise afterwards. Now, I will say there's certain areas that you might be a little bit swollen, but the great thing is you can get up and walk out the door and feel perfectly fine. Okay, any other questions? Yeah, absolutely.
How long does it last?
Well, once you get, how long does it last? So CoolSculpting, just like the Kybella, once you get rid of a fat cell, you get rid of a fat cell. Now, if you end up gaining a lot of weight, well, you could obviously gain some of that fat back. But do you guys want to answer that at all?
Yeah, no, I would say the same thing as you. Once it's gone, it's gone. You can end up gaining weight. And some people will say that they'll gain weight in other places. If they normally would gain it in their stomach, then it'll go to the next spot. But because it does last, so.
Right. Once your fat cell's gone, it's gone. Anything you want to add, Amanda? No. All right. All right, guys. Thank you so much. Janae, thank you. And now we are going to go talk about NovaThreads. So we started doing thread lifts a number of years ago, and thread lifts are great because they don't have the downtime of a facelift. And a lot of times people don't really want a surgical treatment. So we had been doing InstaLift for a number of years, and then, and then we ended up doing NovaThreads last year. And NovaThreads are wonderful because they not just lift, but they also help to build collagen, and they can also help volumize. So there's 3 different types of threads. You have lifting threads, you have volumizing threads, and we have threads that build collagen. So I have my visual aid here. And as you can see, you have lifting where we can lift in the brow, we can lift the jawline and the neck. You can have volumizing. A lot of times we'll put them kind of in the folds, or if people have those glabellar lines. And we can also build collagen, like if we treat them around the crow's feet or in the crepiness of the neck. So in addition, I did want to actually briefly talk about using fillers as a biostimulatory product. So we can actually use fillers not just to fill volume areas that have lost, but you can also use fillers to help stimulate kind of the collagen and crepey skin. So one of the things that we've started doing, which I'm really excited about, is using calcium hydroxyapatite as a biostimulatory filler. And I actually wanted to show you a picture of a patient's thighs. She graciously allowed us to use her, it's actually her knees. But if you look here, this knee over here was before we treated it, and then we injected it with dilute calcium hydroxyapatite. And this is 2 months later, and you can really see a significant improvement in the lines around her knees. So where could you do that? You could do that in the neck area if you kind of have that crepey neck. You could do it above the knees. You could do it in the chest area. So a really exciting opportunity for a different use for fillers. All right, let's go look at our threads. We have Anna, Megan, and Jessica, who now should be in here. Hello, guys. Oh my gosh, look at my beautiful team. Aren't they wonderful? All right, so here we have Renee, our wonderful nurse and model, and Christy, our amazing nurse. And we have Anna, Jessica, and Megan again. And I want you guys to tell me a little bit about what you did. And each one of them did a different treatment, and Megan is going to showcase a treatment while we're watching live. So Anna, go ahead and tell me a little bit about what you've done. Wonder if I should come around this way. Okay.
Okay, so when we were looking at Renee's face here, especially for her brows, she had a little bit of laxity on her upper lid. So a great treatment, especially in the forehead, are NovaThreads. And what we did was insert here right by her eyebrow, and we went up to lift up and tighten from this lid. So if you can see, her eye now has a really great arch on both sides. We went ahead and did both sides of the treatment beforehand. So she's got nice arch and lift.
and that's going to help from preventing this saggy, droopy lid.
Right. And over time, what you'll notice is that it actually will build a collagen tract, which will help lift that a little bit as well. Now, the great thing is I noticed that it almost looks like you have nothing but a little dot under your eye.
Yeah, so
That's
she had
wonderful.
very little downtime. All we did was one small insertion point on each side, and you really can't even tell. We did a little drop of numbing, so did you think it was pretty comfortable?
Yeah.
Yeah, perfect.
So how did it feel?
It just, the numbing sensation, and it was done within less than a minute.
Yeah. So lifting threads of the brow are great. All right, Miss Jessica, and tell me kind of what you did.
So it's really the same idea as the brow. So these are barbed threads, so they're really good at helping to pick up tissue and lift and holding. So typically to help lift the lower face, pick up that kind of skin around the jowls and sagging skin, we do an insertion point, you know, typically more toward kind of the posterior part. And in Renee, we only did 2 threads. Oftentimes we'll do more, but even with 2 threads, hopefully you can see that she's gotten a little lift through here. We did kind of one angle this way, one angle this way, and it even kind of highlights her cheekbone as though she even had a little filler. And it even helps her jawline look more defined.
Someone says you're so pretty, Renee.
Thank you.
She is.
I know. Well, and could you do anything underneath the neck?
Oh yeah, absolutely. So, so Renee, she has a pretty nice neck here, but that is something that we get asked all the time is what can I do to kind of help with the neck? And there's lots of treatments, and NovaThreads are kind of that instant lift. It's like that lunchtime lift. So if you want some instant gratification, these threads are amazing. We can just use a couple kind of oriented this way, and within minutes, you have a really nice kind of more defined jawline.
Wonderful. And then we're going to talk about smooth threads, and Megan's going to show us a couple. I did want to ask Anna, you've done a lot of smooth threads underneath the neck as well. Tell me kind of how you do that, and what do you think of the results?
Sure. So the smooth threads are a little better at creating almost a mattress underneath the skin. Not so much for that lifting and pulling, but for creating a nice taut look, especially if you feel like you've got laxity or crepiness in the skin. So even on myself, I did them right underneath. Actually, Jessica did them for me, right underneath the jawline. And you just pop them right in. The threads stay under there, building this collagen mesh network. And it just creates this nice tight lift there.
Okay, perfect.
We do have a question. How
Yes.
long do NovaThreads last, and how does the price compare to filler?
Okay, so great question. Threads are going to last you anywhere from about 6 to 12 months, knowing that you are still going to get a little bit of collagen stimulation. Your fillers are going to last you anywhere from 8 to 18 months. They're really doing different things, but sometimes we'll do threads over fillers depending on the person, and sometimes we'll do them both. But there are times where I might just pick threads to help kind of lift the cheek, lift the jawline, and lift the neck. Part of it really honestly depends on the person. I will say that if you are a very active person and you're a fast metabolizer, your threads and your filler will go away a little bit faster. So, Megan.
Okay, so now we're going to go ahead and start doing threads for the crows. So Renee, go ahead and smile for us. So for Renee, now you also do Botox for your crow's feet, but threads like we're talking about, like so more so for Anna, these are smooth threads that we're using. That's going to help build up that collagen, and it kind of also just help rejuvenate along with when you keep up with your Botox. So I'm just going to go ahead and get started here, and we'll just show you that it's something that's pretty simple and straightforward, and you're going to be staying pretty superficial to the skin, and it's pretty comfortable.
So we have a lot of patients who after Botox will actually still have a lot of crepiness around the eyes. And so we like to put the smooth threads in a kind of like a mattress pattern, like Anna said, and almost a mesh. So what you see here is Megan's inserting them, and they have that sharp little needle, and then the thread just slides in and stays right under there. So usually we'll end up doing about 3 and 3, and we kind of cross them. But Renee, as you can see, really doesn't have that many lines, so she doesn't need them that much. Do you want to add anything else on threads?
I don't think so. I mean, as you can see, it's something that's really well tolerated. It's quick and easy, and it's something that you continue to get that collagen rebuilding over time. So it's a really nice treatment to add to anything you're doing.
Right, wonderful. And like I said, we did have a question earlier about treating lines in the forehead, but if you had somebody who had like deep lines in here, you could also do threads in those lines, and that's where we would do the twist threads, or a little bit more volume. And I also like to do those in a mesh pattern.
Or the lips too, or
Oh, very good point. You want to talk about that a little bit?
Oh yeah, sure. So the twist threads, again, if we're kind of looking for a hint of more volume, maybe if you're a little bit wary of filler in the lips, but you still want a little bit of definition, this is a super quick, easy treatment to define your lip border and just give it a little pop. It's perfect.
All right, perfect. Thank you, guys. Renee, thank you. All right. Right, so guys, our new treatment that we are going to be doing, which I have told some people about over the last few months, is we are going to actually be showcasing a new treatment called MonaGold, which is also AquaGold. And this treatment is really, really exciting because you can customize it to the person's skin type. So what is it? So basically, we have a micro injector, which I'm going to show you in a second, and we put different things in it. We can put Botox, we can put your own PRP, we can put a little hyaluronic acid, and we stamp it all into the skin using these gold-plated needles. They go in down a certain depths, and it delivers all that serum right into the right plane. Afterwards, it gives you this airbrushed look like you just stepped off the runway. It helps with things like pore size and texture, and it's really great for acne. So I'm really excited that we're going to be introducing the treatment for all of you. All right, let's see if we're ready with our patient. All right. Hello. So here we have our nurse Brooke again, and we have Emily, our patient. Wonderful, who has very, very nicely volunteered to do this treatment for me. Okay, so here is my AquaGold, which we will call MonaGold, and I wanted to show you this little micro injector so you can see it. It's really cool. All right, so here you can see it has these gold tipped little needles, and then my canister is where I'm going to put my special serums, okay? So what I have is I've actually already pulled up all of my serums. So in here, I have a little bit of hyaluronic acid. So I'm gonna go ahead and squirt that in. So hyaluronic acid is a great building block in your skin. As you get older, you actually lose some of your own hyaluronic acid. It's great in this treatment because it's going to attract water, and that's one of the things that's going to give you that airbrushed look. Then I'm going to put just a little bit of lidocaine so that it helps make the treatment a little bit more comfortable. And then I have 20 units of Botox. So Botox, when you inject it not too deep into the muscle but into the skin, actually helps treat your oil glands, and it helps with your pore size. So we've got that in there. And then I have my liquid gold, or my PRP. Well, actually it's Emily's PRP. So we're going to inject that into here. All right. Oh, this is so exciting. It's almost like we're like cooking in the kitchen. I like to cook, if you don't know. All right, so here we are. This is Emily's little MonaGold serum. All right. I know, sometimes I crack myself up. I don't know why. All right, so here we are, and you can see it's this little micro injector. We've mixed everything up in here, and I'm just going to put your head down just a tiny bit. Thank you, ma'am. All right, and I'm going to have you turn this way, and I'm just going to start stamping. And how does that feel?
I barely feel anything.
Oh, I asked her how does she feel, and she said I barely feel anything. Oh, feels like it's not coming out. Hold on one second. Should be coming down. We take off the cap, yeah. All right, there we go. All right, and so you just kind of stamp it across the face, and you can see it coming out, and it still feels okay.
Mm-hmm.
And we're just going to go all the way across, not very painful, and we're delivering all of that great stuff right into the right layer of your skin. So we are going to have these a little bit customizable. You can do just Botox. You can do Botox with the hyaluronic acid. You could do Botox, hyaluronic acid, and PRP, just like we're doing for Emily here. And as you can see, she really looks very comfortable. All right. Any questions?
Not so far. I think everyone's just soaking in this exciting new treatment.
Well, I have been very excited to do this treatment. And it did take me, I wanted to kind of research the different options. But the great thing is we can put other things in here as well. And I'm just excited to be able to offer something that can treat some other things like pore size and texture, acne, and really there's going to be absolutely no downtime. Now what she'll notice is that her skin, it'll probably take 1 to 2 days, 3 to 4 max, for her to really start noticing a difference in her skin. Now, Emily's very lucky because she actually has beautiful skin. And so I think this will make it even prettier. How often would I do this treatment? I probably would do something like this maybe every 4 months.
How does this differ from microneedling, someone asks?
That's a great question. So this has a very specific, the question is, how does this differ from microneedling? And so you are using the same concept of needling something kind of into the skin, but this is actually needling at a specific depth. And when you microneedle, one of the things that people say is, well, why can't I just microneedle and then put Botox on top? And this actually delivers it into the specific depth of the skin that you want it to go to. And you can safely kind of go around the eye, which people really like.
The next question is, what is the special promotion on this? Does it have one for anniversary event?
It does. So I think, and Casey, correct me if I'm wrong, but if you just want to do the Botox, I thought it was 400 and then 600 and then
468?
yeah, 468.
And then 570.
I know more than our marketing director. So the price will be 400 for just the Botox, and that's Botox all over your face. If you add your hyaluronic acid, you're looking at 600, and then if you want to do the PRP, it's 800.
Yes, that's the introductory pricing, and then it'll go up.
And how do you feel so far?
Great.
I do want to, and as you see, we still have a little bit of serum left, but she's very comfortable. And I'm just going to go across her nose. And we did put a little bit of numbing on Emily, so that probably helps as well. Now, is there one area that you don't like more than another?
Not really.
All right, I'm going to kind of go across her upper lip here because I see just a few little tiny fine lines that I really want to get to. But all of our providers can do this. It doesn't need to be just me. And then, like I said, we just want to customize it just to what your needs are. All right. I'm going to finish it out a little bit on your forehead. We're almost done. Perfect. All right. Well, guys, I hope you enjoyed our first virtual demo at our anniversary event. please let us know if you have any questions. Let us know how we could make it better. And then if anybody wants a consult, we still have some openings tomorrow. We have consults going from 1 to 7. And if you want some, you can Clara us, you can call us, and just let us know, and we're happy to get you scheduled.
And we'll have this promotion out tomorrow.
Oh yeah, and we'll have the promotion out tomorrow. And again, with the consults, for coming to a consult, you actually get $50 that you can use towards product or services. And if you have a friend that you refer, you and your friend actually get an additional $50. So, and that's it. Easy peasy, lemon squeezy, right? All right. Well, guys, thank you so much for joining us this evening. I always love being able to bring you interesting and fun things. And like I said, please give us any feedback. Bye.